Okay, so we're going to do some open tracheostomy suctioning. This patient is on supplemental oxygen. They have a trach collar on with a corrugated tubing going to the bubble bottle. Okay. What I need to tell the patient is go ahead and take some good deep breaths. Because this patient isn't on a ventilator, I'm not able to give them 100%. I could give them 100% oxygen if I were to bag them. But this is a patient who's been in the hospital for a few days. He's got pneumonia or maybe a fungal infection. The first thing that you want to do is, of course, wash your hands, identify the patient, introduce yourself. I'm Mrs. Shepard, and I'm going to suction you, okay? I notice that you've been coughing. It's been a couple hours. I need you to take some good deep breaths, okay? What you need to know is that you need to use a mask when you are suctioning a patient, open suctioning, because when they cough, it's going to come right out directly at you. And if that patient has something that's contagious and you're a little bit susceptible, you will get it. And you really don't want to. Now, you'll see people who don't use a mask when they suction. This should not be you. This should not ever be you. And if you do this for testing, you will fail. If you don't get a mask, if you don't put it on, you will fail. Okay? So I'm going to open up my sterile suction kit. First thing I'm going to grab when I get it out is the cup. Open it up. Now, I'm going to grab my gloves out of here. Let's see if I can put my gloves on without contaminating them. Now, with open suctioning, you have to be very, very careful that one hand is sterile and one hand is clean. And even though I'm putting these gloves on using sterile technique, one of my hands is going to become clean. Now you'll see that there's two different color gloves on me. This is just to illustrate to you which one is clean and which one is sterile. You will not get them in the kit like this. Okay? So now my suction catheter is here. I'm still sterile. Now this is clean. Okay? I'm going to put this on the end. Testing my suction. You take some good deep breaths. Good. Still sterile. I'm going to loosen up the collar. Take the collar off. Just lubricating the end of my suction catheter. I'm going to place it into the trach. The patient is going to begin to cough. I'm then going to place my hand over the suction control. And making sure that this hand stays sterile, because I'm placing this directly into the patient's trachea. This needs to stay sterile. This is, again, my clean hand. I can then clean the mucus out of the suction. Yeah, go ahead and take some deep breaths. Cough, 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 cough. Put the oxygen back over. Sometimes with thick, tenacious sputum, you can put a little saline down into the patient's lungs. I don't really do that. Some people do. I also like to suction after the patient has had a respiratory treatment. They've had a bronchodilator and they're starting to move some of that mucus. When they move it is when you should be removing it. When you're done suctioning, part of your skill says that you can then perform oral care with this suction catheter. I don't like to do that. Get another suction catheter, use clean technique, or use the yank collar. When you are done with this catheter, you're going to grab it with your sterile hand, wind it around so the whole thing is in my hand, and now it's gently inside the glove, throw it away.